Today I have the honor of sitting down with who I think is one of the most influential women of 19th century England, Florence Nightingale. Not only is she known as the very first nursing theorist, but she is also considered the pioneer of professional nursing. Nightingale's environmental theory has changed the face of nursing practice. Her theory was born during the Crimean War in 1853, when she led a team of 38 nurses to Turkey to care for the wounded British soldiers. The living conditions were deplorable, and the spread of infections and communicable diseases were rampant. Through Nightingale's nursing observations, assisted by her statistical savvy, she realized a strong correlation between the patients who died and their environmental conditions. Nightingale's environmental theory of nursing is a patient care theory. That is, it centers on the patient rather than the nursing process. In this way, the model must be adapted to fit the needs of each individual patient. In fact, Nightingale wrote that if a patient is cold, if a patient is feverish, if a patient is faint, if he is sick after taking food, or if he is a bedsore, it is generally not the fault of the disease, but of the nurses. Nightingale's model focuses on creating the optimal environmental conditions so that nature can cure. This can be best summed up by Nightingale herself when she said, "What nursing has to do is to put the patient in the best condition for nature to act upon them." Nightingale identifies the following sub-concepts of the environment that put the patient in the best condition: ventilation and warming, light and noise management, cleanliness, health of their home, bed and bedding, variety, chattering hopes and advice, food, and observation of the sick. In regards to ventilation and warming, Nightingale wrote, "Keep the air he breathes as pure as the external air without chilling him." Nightingale believed that second to fresh air, the sick needed light. She viewed unnecessary noise as cruel and stated that patients should never be woken up intentionally or accidentally. She also felt strongly about cleanliness of the area and personal cleanliness and hygiene, and transformed hospitals from death houses to sanctuaries of care. Her attention to cleanliness impacted mortalities greatly. In regards to health of houses, Nightingale said that badly constructed houses do for the healthy what badly constructed hospitals do for the sick. Bed and bedding. She believed that beds should be placed in the lightest part of the room and placed so that a patient could always see out of the window. Variety. She discussed the need for changes in color and warmth and form, including bringing the patient brightly colored plants or flowers. She also believed in activities to prevent boredom of her patients. Offering hope and advice. She wrote that to falsely cheer the sick by making light of their illness and its danger is not helpful to their healing. Food. She noted that individuals desire different foods at different times of the day, and frequent small servings may be more beneficial to the patient than a large breakfast or dinner. And lastly, observation. As a nurse, the importance to recognize the symptoms of our patients which indicate improvement and which indicate the reverse are very important. To Nightingale, any impediment of the patient's recovery is based on the lack of knowledge or attention to any of these variables. To date, thousands of studies have been performed to look at the way that design influences healthcare. Though Florence Nightingale may not even know it, her recommendations for improved hospital designs are evident today. For my virtual lunch with my theorist, Florence Nightingale, I would meet her at BC Children's Hospital, the latest state-of-the-art hospital design. Before our dinner, or our tour, we would have our scones and tea sitting in the natural light of one of the many beautiful rooftop gardens of the newly developed hospital. Then, we would tour the new hospital to see how the adaptations illustrate Nightingale's way, her concept in the way in which we are affected by form, color, and light, and how the hospital design has incorporated her original thoughts on the environment to heights that I suspect she could never have imagined. A few of the pieces that I will include on our tour include the emergency department that comes with an interactive virtual aquarium, the room where procedures such as bone marrow extractions are performed, as it has a ceiling lit with many as 100 twinkling lights to recreate the night sky. I think that Florence would also enjoy to see the many different portable x-ray machines decorated as giraffes and other animals. Finally, I would take her on a tour of the patient rooms, where she would see that each patient and their family has their own single room. Florence would see that her ideas and recommendations from many, many years ago have come to fruition as these environments have been designed based on findings that single rooms ensure adequate privacy and space for each patient, improve sleep, and reduce stress of the patients, as well as reduce the chance of spreading infection. I truly look forward to meeting Florence Nightingale and asking her a few questions to better help me understand her theory, as well as to help me in gaining real-life guidance on practice issues I face in my own work life. I have formulated 4 questions that I would love to ask Florence while we meet over scones and tea. Number 1. Florence, in hindsight, would you modify your views on not wanting to wake patients? The reason I ask Florence this is because in my own pediatric practice, while I integrate your theory regularly, this is one component of the theory that I feel too extreme and can even hinder on patient safety. Florence, I know that you believed in the concept of noise and that patient sleep should not be disturbed at night. However, working in acute pediatric cardiac and respiratory ward, not awaking my patients at night for medications, procedures, or vital recordings could be the difference between life and death. Number 2. Florence, in hindsight, would you add anything about medical technology into your theory? My rationale for this question is when I read through Nightingale's theory and notes, it hit me that the application of medical technology seems to be non-existent. Although basic at the time the theory was written, it did exist to some extent. In my own practice, medical technology is a large part of a patient's environment. We now have access to compact, portable medical devices that enable patients to be treated on an outpatient basis, as well as RFID-enabled devices that enhance safety and security with less stress to our patients. It seems odd to me to address a patient's environment without also directly addressing medical technology. Number 3. Florence, do you believe that your theory is still applicable in the 21st century? Even after Nightingale's death, I still find the basic concepts of your theory to be applicable, but many nurses like myself are still using her ideas, and she clearly had a strong influence on the professional practice of modern nursing. However, as an RN in the 21st century, I do disagree with Florence's opposition of registration for nurses. Today we know that research has linked registered nurses with higher education to have fewer medication errors, positive patient outcomes, and lower patient mortality rates. I am also curious if Florence considers her theory to be timeless, since the environment of war was a primary factor in her theoretical construction of her theory. The war environment was made up of rats and fleas with no blankets, beds, or food. Soldiers suffered from frostbite, cholera, and typhus, living in utterly chaotic, unsanitary, and inhumane conditions, whereas today, those types of circumstances would be considered unusual. Fourth, Florence, you present the cause of disease and/or non-rehabilitation of the patient as closely related to the environment in which the patient is inserted, which is most often unhealthy. Based on this statement, does that mean that you believe all cancers have an environmental cause? Personally, having worked in pediatric oncology, I have been asked many times by parents whose child has been diagnosed with cancer, why my child? I do believe that environmental, occupational, and recreational exposures to carcinogens can contribute to cancer risk. However, I believe current thinking that suggests that the variation in incidence and progression of cancers among individuals are generally attributed to inter-individual variation in genetic makeup, not exclusively their environment. Florence, a few months back, I had a patient that your theory truly guided my practice approach to care. This patient I will call Jackson. He's a 16-year-old teenager that was admitted with septic shock. Jackson had an infected cut on his foot, which he did not seek treatment for, and the infection eventually developed cellulitis, which then, untreated, resulted in septic shock. Jackson lives on a rural farm above a barn, sharing his every movement with many farm animals, including their feces. Jackson informed me that he does not attend school and is required to help his parents on the farm 6 days a week. Upon further questioning about his work and living conditions, Jackson revealed to me that he does all of his farm work in old sneakers covered with holes. Additionally, Jackson voiced that there is no hospital or clinic within 100 kilometers from his family's farm. I was able to incorporate many of your environmental theory canons, both while in hospital as well as in my discharge teaching. While Jackson was in hospital, I ensured that he had a clean hospital room with daily linen changes. I ensured that his personal hygiene and cleanliness with teaching and reinforcing the importance of daily showering and teeth brushing. I ensured that his meals were spread out and well balanced and nutritious, which in Jackson's case helped with his wound healing. I distracted Jackson minimally, allowing time for lots of rest and sleep. I ensured that he had fresh, clean air to heal in, unlike the feces-filled air that he breathes at home on a daily basis. Nearing discharge, I encouraged the continuation of optimizing Jackson's environment to better his health through the following. I helped Jackson to connect with a social worker to replace his hole-filled shoes. Promoted daily showers, good hygiene, and cleansing of small scrapes and cuts obtained at work on a daily basis. I encouraged Jackson to build or divide a sleeping space that does not share the same space as the barn filled with animal feces, or minimally to dispose of these feces as soon as possible. I also ensured that Jackson had access to healthy and well-balanced food throughout the day by providing him with proper resources such as social work connections in the community if needed. And lastly, although Jackson and his family are not close to a clinic or hospital, I equipped Jackson with a nurse line to call early on in a disease process if he has any concerns so he can receive adequate help before it gets to this stage next time. Florence, I often apply your theory into my nursing practice, as mentioned before. However, I admit that a few weeks ago I had a particular patient, whom we will refer to as Connor, that actually, if I were to have followed all of your canons from your environmental theory, likely there would have been multiple negative effects to his healing. Connor is a 7-year-old autistic boy admitted with a severe ruptured appendicitis. Connor has an extreme sensitivity to light, sleeps best during the daytime, and is only able to remain calm when repetitive music plays with a certain beat. He does best with a structured schedule and an environment that does not encompass any form of variety, and it has been found that he is easily overstimulated. For Connor, since routine is so important, pieces of the environmental theory were applicable and helped in his healing, such as maintaining a clean area, maintaining good hygiene, small frequent meals, and of course, observation of Connor were all achievable canons. However, with following the environmental theory's canon recommendations, I ran into a number of contraindications as follows. Number 1. Florence, your belief that patients need direct and bright sunlight is usually true in my practice. However, for Connor, who is light sensitive, this act would cause his behavior to escalate, which would negatively affect his healing. Additionally, you have suggested placing the bed in the lightest part of the room, which for Connor would have also been a behavioral trigger. Number 2. In regards to noise, it is suggested that unnecessary noise was cruel. However, often, the only way that Connor would comply during a procedure or assessment was through his music. Number 3. Florence, regarding not waking patients unnecessarily, with how acutely ill Connor was, and him preferring to sleep during the daytime, it was required to regularly wake him up during the day for procedures, tests, and vital sign monitoring. Number 4. It is recommended to not talk or bug our patients while they are eating. However, for Connor, he requires constant encouragement and reminders to eat, otherwise he becomes too easily distracted and will barely eat anything. And lastly, we have found that Connor functions best with routine, the same staff, simple colors, and repetitive activities. Therefore, your recommendation for variety in the context of new activities and change in color and form would have severely upset Connor and again triggered negative behavior. Florence, I would love to know how you would have recommended to approach a unique patient like Connor with the guidelines of your already existing theory. To conclude, Florence, I find myself thinking about you each time I take a patient up to the hospital rooftop garden on a sunny day. As a pediatric nurse, the instant transformation I see in both their body and spirit is one that I know medicine alone can clearly not achieve. While I do believe that not all optimized environments are the same for each patient, your environmental model is beneficial much of the time. And although it is more than a century old, I believe that it is applicable in the most fundamental nursing interventions. Moreover, I believe you would be proud to see how in the 21st century we have taken your original concepts to new heights, as seen on our current patient care through our tour, as well as in the hygiene standards of the current hospital design. Thanks for meeting with me.